Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department here at MCHD, and I've got a nice panel of art people here in my gallery, and we're going to be talking about the potential health benefits of art therapy. So we'll kind of go around a little bit. Melissa, you go ahead and introduce yourself.
Hi, everybody. I'm Melissa Creighton, Grants Manager for Family Health.
All right, Dr. Matilde.
Hi, I'm Dr. Matilde Tellaetxe, and I teach at the University of South Alabama.
And lastly, Lucy.
Hey, everybody. I'm Lucy Gafford. I'm the Executive Director at the Mobile Arts Council.
Well, the reason why we have, this group assembled today is, what I just mentioned here about that topic. So, Melissa, give us a little bit of a historical perspective as to why we do what we do and why we started that here at MCHD.
Well, that's a great question, James. I know earlier offline before we started recording, we were mentioning how long we've been doing this, and it might shock our viewership to kind of recall back to when the therapeutic art experience, the art beat, as it were, began, but it was back in May of 2021. So it's been a 2-year run for us. We're really excited to have our own, world-renowned, who recognized our in-house artist, Ty Tover, who unfortunately could not be with us today on this panel, but his contributions are paramount to our therapeutic art experience and how we utilize art through the Mobile County Health Department's Family Health Primary Care Division to reach out and touch our patients and speak to them on a different level, because we all know that art has a healing component. Art is good for the soul and good for the body. So yeah, it's just been a great run, and I'm so glad that we have all of these expert panelists to talk about the benefits of art in the healing process.
Yeah, we refer to Ty as our own Bob Ross with sauce. He's a little extra flair there, but Melissa has one of Ty's pieces, I think, from the last session. If you want to hold that up, that's one of the most recent ones. He did a watercolor, and he's got a theme that he goes by and a reason why he paints what he does, and all of his people have the same shades of blue for their faces, and it's really interesting. It's been very successful when we've broadcast that art therapy on Wellness Wednesday. So, Dr. Matilde, you're kind of our subject level expert here, and you've got some real world experience with this. Now, let me pull the article back up today, the Everyday Health article, which we're going to be putting a link to also when this goes online. The benefits, potential health benefits of art therapy. Some of the things that it talked about in the article were that art helps reduce stress. It improves symptoms of depression and anxiety. It builds self-esteem and self-image, and it helps cancer patients manage their pain and stress. People have seen improved behavior in autistic children, and it can potentially help people with PTSD. So with your works directly at USA and also with the Mitchell Cancer Institute, can you tell a little bit about how you've utilized that?
Well, I am on the gathering of knowledge and passing the information to the students so that they can become promoters of the art healing process. Now, I can tell you too that I have experienced it myself. That was one of the reasons why I decided, after becoming a medical doctor, basically working on academic settings and research all my life, I decided to study and go and get a bachelor in fine arts too. But I have also experienced it in my classes. When my students engage in any project of art, they immediately relax, they immediately feel more at ease. And this helps the group to become more cohesive, more expressive. They are less worried about other demands in life, and it promotes the conversation, some of them, and they feel like entirely different people by the time they leave the project or by the time they leave the class. So I have hands-on experience. I have also used it with my children, of course, and I have seen that you are one before the art project and a different person once you are engaged in it, and a different person when you are done with it. And we are talking about the process. We are not talking about the product. We don't have to be Picasso. We don't have to be great artists. We don't have to worry about how wonderful or perfect it looks, how artistic it looks. We just have to enjoy the experience of being able to play with line and shape and color and put things together and allow our brain and our hands to work together toward the achievement of what is an idea. We have an idea and it becomes materialized and in front of our eyes.
Yeah, we talked about this several times before on Wellness Wednesday with other panelists, but it's all right brain, left brain, and when you unlock the creative side of your brain, then it does promote all of those self-aware endorphins, and it just kind of feels good. So, Lucy, you have, you've been in the art world probably all of your life. You've worked with the Boys and Girls Club and other organizations and at-risk youth. So, tell a little bit from your perspective.
Sure. So yeah, through various positions I've had at the arts councils over the years, I used to do outreach programming with the Boys and Girls Clubs, and I've done some public art projects with the Strickland Youth Center students, and you will see firsthand just the confidence that these students gain through completing these projects. Also, like Poetry Out Loud, you'll have students who come in who are just riddled with anxiety and really do not want to get up on stage, but they're putting themselves through this position, through this program, just so that they'll gain that experience and they gain that confidence, and they're a different person by the time the program's over. They're just totally transformed. And through these public art projects that we've done with Strickland Youth Center with these students, these is so important for them because they gain like a sense of ownership and pride in their community by creating a piece of artwork that's there permanently on the side of a building. And with the Boys and Girls Clubs, just seeing a student through the start and finish of creating like a piece of pottery, just not knowing that they're able to, like Matilde was saying, complete something and have it materialize into an actual like three-dimensional object that has like a gloss finish that they would see at the store and they had no idea they could complete it themselves. It's really transformative and so beneficial for everyone to be able to have access to opportunities to engage in the arts.
Yeah, you brought up something there about the public art or the outdoor art with the murals, and that's a completely different feeling. If you draw something and it hangs up on the wall or in a gallery, it's there for a little while and then it's taken down, and or refrigerator art, in mom and dad's house. But when you put a mural up, that's permanent. As permanent as you want to be able to get. And then people that drive by there or they're walking in downtown, they see that all the time. So there is that sense of pride and that sense of achievement, when you see it and everybody sees it or they take pictures by it. And it's a win-win for the student, and also for the community when you install things like that. Now, from my perspective, I'm a graduate of USA from the visual arts, and I like to look at the campus like this. The business department is on one side of the campus. Then there's like a really long empty field. There's 6 lanes of road, and then the visual arts building is on the others. That's how far they like to keep them separated, So I think of it like right brain and left brain. And my side of the campus, we were always very relaxed, and people wore pajama pants to classes and things like that. That wouldn't fly in a business building, but it does unlock that other side of your brain, that creative relaxation side of it. So anything else y'all would like to share maybe about your real experiences? Like, maybe for instance, Melissa, working with Ty, and as he's done these paintings, we've even had some showings here too with some patient art and some supplied art from people that have gone through the program or continuing with this program. So I know that's good to see around here.
Yes, Ty does a great, phenomenal job of engaging the patients and clients and staff and getting contributions of art from all different mediums. And that's just what's really astounding about Ty. I feel like watching Van Gogh go through his like blue period, because before, when Ty, first approached me about, the therapeutic art experience, most of his canvases were solid black. And now he's kind of evolved into this, white canvas and using watercolors. And it's just amazing to see that he can, morph and evolve. And I don't know, everything's just more amazing every time he does something. So art is truly organic, and I can't draw a stick figure, but I can very much appreciate art and very much appreciate the time and effort that goes into it, and how it makes me feel. And I can only imagine how it makes others feel when they're, doing it and viewing it. And it's just a benefit for everybody in the community.
I think you touched upon it also too. The art process. It's a peak and a valley, an ebb and a flow, and you see the evolution of an artist through their work, how they feel, their expressiveness, how outside influence have changed them, or how they have changed historically over time. And we've certainly seen that. Like I said, with Ty's work or anybody else kind of coming around through it. The other thing we haven't mentioned yet too is, art as an escape or as a hobby or as a profession, it's not very expensive. I mean, you can pick up art supplies anywhere, dollar stores, and it's not a big investment of money to be able to start to do it. And there's a lot of artists also too that I studied there South. They started with no money, and people donated things to them and gave them things and found objects, and that was their art. So that's sometimes it's a financial barrier for people when they want to start something or a hobby. Woodworking is expensive for all the tools and everything else, but art, no. I mean, I just was in a dollar store this past weekend, and a pack of watercolor pencils were $2. A watercolor kit was $3. Canvas was $1. So it's extremely affordable. So let's jump back over to USA. So when did you get the idea to try to incorporate this with the Mitchell Cancer Institute?
Well, this was, as I said, 12 or 13 years ago. That was the moment in which the first studies with actual data were coming out to show the improvement in cancer patients, working with mandalas, another kind of statements. And as I mentioned, I experienced it myself. So I really wanted to contribute to the community through doing something innovative and something that could help the patient outcome too, because we sometimes we tend to think that some cancers have worse outcomes because the cancer per se, but it's really because the patients haven't been given the chance to work with processes that would allow them to be more engaged with how to take their own treatment, how to participate with the doctor, how to feel in a community, even if it is in the hospital. So it was an initiative that Dr. Severin Grenoble, a psychiatrist, Dr. Thomas Butler, and myself took. And we used to get together in Panera to have a cup of coffee, gather data, write grants, but we were extremely unsuccessful then because our therapy wasn't being seen as any sort of important tool for intervention. So yeah, let's say that we were a little bit ahead of our time. That was probably what happened. And then with time, we have had more data coming from respected journals out there, and publications that are, backing up our suspicions and our our findings. So it was really an initiative on having, trying to share something that worked out beautifully for myself and for those around me to help the patients within the community.
I think it's a great idea. I think, non-traditional means of, helping the patient, it doesn't necessarily always have to be medicine.
Right.
Because, when you treat a patient, you treat the mind, the body, and the soul. So
Yes.
that's a well-rounded person. So brilliant approach.
Yeah, and sometimes the problem that the patient has is that they don't seem to see a future. They feel that they have been given the cancer diagnosis, and they immediately feel that it is a death sentence. And by working with collage and working with other means of artistic means, they can imagine a future, and they can improve their hope and their ability to even reach for help and get together with other people that can share different stories. So it really is it's a wonderful tool. It really is a wonderful tool. But not only for cancer patients, it's also good for patients that have suffered from a stroke. Is good for patients that suffer Parkinson. Is good for any patient that has problems expressing their thoughts, because sometimes what happens is that you were mentioning the right brain and left brain. If the wound is too deep, the language area of our brain seems to shut down. So it's more difficult for us to express our feelings and our own story. And art, you don't have to be Picasso, but art allows you to put things in. Art allows you to make a story, even if it is very primitive. You can draw stick figures and say, this is my mother, this is my son, this is what happened. And you don't need to engage in a whole rhetoric or a whole explanation. You just have to use your fingers and your hand to say what happened. And that expression is the first milestone for recovery, is to put it out there so that others can help us get more hope and more at ease with whatever has happened. And that's what happens in trauma patients.
Well, from the medical community, we certainly appreciate your approach and what you're doing. Now, from the Mobile County Health Department, health is in our name. So, I mean, we're all about health. A few years ago, we partnered with the Arts Council to talk about outdoor art, to get people out in the community walking around, because there are people walking through downtown all the time, and they walk right by something they think is, I don't know, a piece of, construction equipment, but, it's a bike rack, or artwork that's installed. So, Lucy, do you want to talk a little bit about Mobile Art Go and, what the reason behind it and the health perspective, walking around using the Google map and, taking a look at outdoor art?
Yeah, so that's a direct, physical benefit from the public art standpoint, is getting people out and about indoors and getting them engaged in a different way, educational perspective on that, using the ArtGo platform. You'll hear about the artists and when they created the work, the mediums used. So that's been a great project. And James created the website and the map for that. And we're expanding on that currently with the city now, which is exciting. And, I'm going to just piggyback on some of the conversation we had earlier, just about Ty and his work.
Mm-hmm.
Ty has some public art pieces. We've been doing those utility art projects with the utility boxes, and Ty painted one of those. And he had an exhibition in our gallery, and you know, he's organized these World AIDS Day art shows where he has different patients, you know, and himself create these pieces of art and do spoken word. And, you know, art also serves as a really important tool to have difficult conversations that you may not be able to have otherwise. And he's been so instrumental in being able to orchestrate that through his work. I know he had a lot of really great conversations with people who he had just met, you know, the night of his exhibition opening, who left, you know, feeling, you know, very engaged and
Mhm.
you know, bought his artwork as a constant reminder of those conversations that they had with him and how it impacted their lives. And yeah,
May I
he
say something
sure.
according to this? Yeah, the contemplation of art, the contemplation of beauty has a tremendous impact in our health too. Just contemplating it, it triggers once again the relaxation response. And in order to capitalize in this, 10 years ago, I worked with the Museum of Modern Art in New York, and I brought the program that they were using for Alzheimer's patients. So in the Mobile Museum of Art, with Debra Belders as our director, we engaged in setting up a program for Alzheimer's patients too. And we did it successfully. The program, we got everybody trained, you know, our volunteers, we got a beautiful program that was put out there for the Alzheimer's patients. They would come every Monday to just contemplate art, and that contemplation of art promoted the talking among the members of the community. And the only problem that we had was that we had very little response from the part of the community. And we suspected that it was because of the stigma that sometimes saying that you have Alzheimer's can be, because the patients that would come to our program that was called Keepsake couldn't be in the late stages of Alzheimer's. They have to be at the beginning when you still don't have major symptoms of dementia. But they came, and you could tell too that the contemplation of art, the explanations of the beautiful pieces of artwork in the Mobile Museum of Art allowed them to feel entirely different by the time they were leaving. So yes, having artwork out there in the community for others to contemplate is of paramount importance. Once again, it engages our imagination, and we see color, we see shape, and it affects our brain in many different ways that it would be long to explain and out of the scope of the talk, because it's more left brain that what we want to bring to the table today. But having artwork out there in the community is extremely important for people to engage in visualizing, seeing exactly what others are able to imagine.
Yeah, well, you mentioned it just a moment ago there about the stigma, and there are so many different stigmas that surround other, you know, health, you know, aspects and diagnoses, and you know, that's some of the changing the tide. You know, it takes a little bit of time to kind of change, you know, the perspective of it, or change the group thought about it. We're very thankful here that we have the partnership that we do with Lucy and the Arts Council. And I'm really glad to hear that the city is, you know, kind of helping buy in a little bit more too on the outdoor aspect of art, and, you know, be willing to close down this intersection or this area, or give you police support if an artist is working in a certain area. And it just kind of shows that, you know, progressively, you know, we're improving from a community aspect, you know, getting more of the arts and visual arts and a variety of things like that. So it makes Mobile not so dull, right? So, but yeah, I certainly appreciate all of you, you know, being on here. We'll also put a link to Mobile Art Go, because we want to continue to help promote that. I mean, you know, weather's getting a little bit better, and you know, we want to have families and people be able to go downtown and walk around and they don't have to wear masks anymore and all that stuff. And, we're trying to getting back to a little bit of normal again. We had 2 years of weirdness, that
Sure.
you can't explain, but, people were siloed and isolated, and we just want people to get back out again and experience having relationships and the environment and art and everything that we have to offer here in Mobile, and especially in downtown. Melissa, anything else you want to add from the health department perspective?
We're just lucky to have our in-house artist. And for those of you that follow Ty and follow our ArtBeat therapeutic art experience, you can anticipate our 7th therapeutic art installment that should debut in May of 2023. So stay tuned for that.
Yeah, and I got the idea also from Lucy in the throwdown that Ty and I may be doing a dueling banjos thing on the next art beat, where he paints something, I paint something, and just 2 different perspectives, and neither one of us will know what the other one's painting or doing, but and it's obviously 2 different styles of art altogether. But yeah, look for that in all of our social channels that I love MCHD. Well, ladies, thank you for joining us here on Wellness Wednesday and helping just put a spotlight on all of these wonderful programs and things that we're doing here in Mobile County.
Mm-hmm. Yeah, I would like to add just if you allow me to say something, that I think that we have to work from many different perspectives in promoting art. And one of them is that art has to be very present in our schools from the beginning, because it's a pity. I still have students that come to my classes and they still don't feel comfortable being artists because they have been told all their lives that if you become an artist, you are becoming a starving artist. That is useless. So we have to start educating our students when they are little and showing them that is a beautiful potential for health. And we certainly have to promote the use of art in our classes. It's important to gather information and to be technologically savvy and mathematically good and knowing how to write and read, but knowing how to use art and to use it for our benefit is there. This is probably the beginning of a new era for artists and for art in general, and we have to capitalize on that.
That's right. Yeah, starving artist is a stereotype.
Yes.
Lucy and I haven't missed many meals, have we?
No, there's a lot of capital in the arts. I mean, it's a huge industry, and it's crazy that it's projected that way. And agreed completely with Matilde on it's so important to have the arts integrated and available to people from young age to up through their later years. Absolutely, it's so important, and we're working on doing new programming with the school systems here in the upcoming year. Amp Up Arts. I know we're done with the conversation today, but we've got some good things in the pipeline, and y'all keep voicing your support for the arts for students too.
Absolutely. Yeah, and we may have another conversation later on Wellness Wednesday where we talk about art as a career, because I don't think that's really spoken about very much. So,
right.
Hey, gives us another topic for later, right?
Right.
All right. Well, thank you all very much for being on Wellness Wednesday here with the Mobile County Health Department and helping us promote art therapy.
Thank you.
Thank you guys so much.
Bye.
Bye.